Sure.
So welcome everyone, and we would like to welcome the new fellows as well. Thank you for joining. And for those who come later, this is the agenda, and the Orange team is going to lead the Zoom meeting for today. So go ahead.
Okay, thank you very much, Dr. Nader.
Thank you. Thank you, Dr. Nader. Thank you, Dr. Kholood. First of all, I would like to say something.
Go ahead.
Okay, hi everyone. For all of my colleagues that in Sudan, I would like just to say that I understand that you may be feeling anxious and uncertain about what's going on in Sudan. And I would like to say that it's normal to feel that way. And I want to assure you that you're not alone. We all feel the same. And but remember that people in Sudan are resilient and have been through difficult situation before, and they are doing their best to cope with the situation and support each other. Remember that if you feel like you are overwhelmed, may be helpful to talk to your friend and your family. And it's important because I'm not okay, and I'm sure that many of you they're not okay as well. So it's important to take care of yourself, and don't let fear and worry consume you. And let's hope and pray for peace in Sudan, and as well as the safety and well-being for all of those affected by this conflict. Okay, so today we're going to start with the agenda. Our first topic was Dr. Kholood. Please go ahead.
Yes, Nafisa, thank you for this warm feelings, and we hope everything will go okay in Sudan and this conflict will end soon. We will pray for our people there and everywhere. Please, God save them all and save their souls and belongs and save our country. Okay, I'm going to start with the second topic. Let me share my screen. Okay. I can go from screen. So can you see my screen now? Okay.
Yes.
Can everybody see my screen?
Yes.
1 second, please. Okay, I'm going to start second topic, types of variables and data collection methods. Presented with me, my name is Dr. Kholood Ahmed. I'm a fellow in the Telegeriatric Fellowship program, Michigan State University, graduated from Al Jazeera University. So I'm going to start with the first one here. I'm sorry, just give me a second. I want to hide this one. Okay. So we're going to start with the question, what is a variable? In the statistics, a variable is a sample of representing a mathematical object whose value can vary. For example, if you are curious about the age of people in a certain population, and you could assign the variables x to represent those ages. And you might also curious about the political affiliation of your population. Maybe we'll just have this example. In this case, you could assign another variable such as the letter Y represents a political affiliation, where the value might be Republican or Republicans or Democrat. As this, we are in US, this is a major two groups and political.
Sorry for the interruption, Dr. Kholood. I'm sorry. I think we just see like a whiteboard with no slides.
I'm sorry. Okay, let me just stop it and just do it again.
Thank you.
Okay, how about this now?
Yes, we can see it now. For me, I can see it. I don't know for the others.
Okay, everybody can see my screen now?
Yes, now we can see it.
Yes. Thank you so much. I'm sorry, I didn't know about this show.
No worries. Thank you.
Okay, see, I'm talking about the variable, and this is the first question coming here. What is the variable? As I said, this in statistic, we have so many variables, and this representing the mathematical objects. The value can vary. And here I did an example, like have a certain population. I want to assign them as an X letter as represent the age. And I can take the Y to represent the political affiliation, and they might be Republican or Democrat and or independent. So here I use it as age for subject X, age of subjects, and political affiliation as a Y, political affiliation. So I'm going to the next slide. These variables falls into one or two categories. The categorical variables, which represent names and qualities and other labels, which divided your data set into groups for our classes. And you can further classify categorical variables as nominal or ordinal. And numeric variables, which represents countable or measurable quantities. And you can further classify numeric variables as discrete or continuous. So, I'm sorry, it's going on here. Okay, I have the slides here for the diagram. This is the variables. And as you see here, the top one is a categorical or qualitative variables, and it's subdivided to nominal variables and ordinal variables. And we have the bottom here, the numerical or qualitative variables, which is subdivided to discrete variables and continuous variables. And here we have the data categories as more detailed. Let's take a closer look at different types of variables, categorical variables or qualitative, as I said. And again, categorical variables represent qualities and labels that divides your data set into different categories. When you select your nationality or race or survey, your response is stored as categorical variables. You can classify categorical variables as nominal or ordinal, as I said. The nominal, which is variables categorized as variables with no order or ranking based on magnitude or size. And nationality, for example, is a nominal variable as like a blood type. And ordinal is categorical variables where the groups being defined do have a rank or order based on that size and magnitude. I'm sorry. For example, if Starbucks asks their customers what size drink they typically order, short, tall, or venti, the variable drink size is an ordinal variable. The categories is defined have an order based on the size. Similarly, another example for an ordinal variable is the satisfaction rating, asking respondents to judge how likely they are to buy a product. Like they are judging and respond about this regarding the result. Extremely unlikely or unlikely, not sure, likely, and very likely. It depends. So we're going here also in this table for categorical variable examples and numeric variable examples. The categorical variable examples like nationality, gender, and ethnicity, zip code, birth month, educational attainment, blood type, satisfaction rating, as the example I just gave from the Starbucks, and political affiliation. And numeric variables as an age and height and weight and distance, years of schooling, and blood pressure, test scores, number of goals scored, number of people who voted. Okay, as a more expanding this one, and this is discrete variables and discontinuous variables examples. The discrete variables like number of goals scored, number of puppies in the litter, or number of passengers on a bus, Oscars won by actors, or like a number of rainy days last month. The continuous one, which is going like in the future, like or like this time it takes to run 100 mile, or weight of newborn puppies, or distance traveled by on a bus, or income earned from the starring in the film, or the amount of rainfall last month. So we have also raised a question here. Are there more types of variables? The answer is yes. In addition to the categories we have discussed, you may hear the following terminology when working with variables in statistics. Now, the independent and dependent variables. A dependent variable, as called an outcome variable, is a variable whose value depends on the value of other values in your model. The dependent variables is a variable whose value you are trying to explain. For example, in medical research, that's statisticians, the people who are just doing this studies might want to study the effect of various treatments on patients' health. The patient health in this case is a dependent variable. In contrast, an independent variables, also called an explanatory variables or predictor variable, is a variable whose value does not depend on the value of other variables in the model. Because independent variables, are the variables are manipulated to see if they help explain or alter the value of the dependent variables in the causal study. This it means like this is deal with the causation, and independent variables is the proposed cause, and the dependent variable is the effect. We have also the confounding variables have the potential to invalidate your results, since they will invalidate your results if they correlate with at least one or the independent variables in your study, help to explain the dependent variables in your study. If they are not properly accounted for, they can lead to misleading and false results. Yeah, this is like something is affecting your data like passively or like negatively. We're going also to control variables. Control variables are variables you hold constant in statistical study. For example, say you say the study a relationship between the fitness regimen and the regime and the weight loss. Diet, in this case, might be the control variable in your experiment. We're going also to see something called binary variable or dichotomous variables. This binary variable is a categorical variable also with only two possible values. For example, true or false, heads or tails, win or lose. We have also something called a dummy variable. In regression analysis, a dummy variable is binary variable that will either to be 0 or 1. It's like something not good at the study. Dummy variables indicate whether a condition in your data is either present or absent. For example, you could use 1 to show whether the patient received a treatment and 0 to mean that they did not receive the treatment. We have also intervening variables or mediators sit between the independent and dependent variables and help explain how the independent variables influence the dependent variables. These variables are not always included in this your statistical analysis because they are hard to observe. Statisticians often just hypothesize about them. It's not something like true. We're going to moderating variables or interaction variables. Moderator is a variable that impacts relationship between the independent and dependent variables. For example, if you are studying the relationship between going to college, independent variables, and future earning dependent variables. College measure might be moderating variables between these two variables. This likely influence the relationship between college education and the earning. Now we just finished by this few points about the variables and types. We're going to see the data collection. We'll start with definition for data collection. Data collection is the process of gathering and collecting information from various sources to analyze and make informed decisions based on the data collected. This can involve various methods such as surveys, interviews, and experiments and observation. In order for the data collection to be effective, it's important to have clear understanding of what data is needed and what the purpose of the data collection is. This can involve identifying the population or sample being studied, determining the variables to be measured, and selecting the appropriate methods for collecting and recording data. We have so many methods for collecting the data. So here we are talking about data collection methods. And data collection methods are as follows. We'll start with, we have survey. Survey involves asking questions to, as you know, to a sample of individuals or organizations to collect data. Survey also can be conducted in person or over the phone or online. We have also interviews. Interviews involves one-to-one conversation between the interviewer and the respondent. Interviews can be structured or unstructured and can be continued or conducted in person or over the phone also. We have also focus group to collecting data. Focus groups are group discussion that are moderated by the facilitator, and focus groups are used to collect qualitative data on a specific topic. We have the observation. Observation involves watching and recording the behavior of people, objects, or events in their natural setting. Observation can be done overtly or covertly. Overtly or covertly, yeah, depending on the research question. We have the experiments. Experiments involve manipulating one or more variables and observing the effect of another variable. Experiments are commonly used in scientific research. Also, we have the case studies. Case studies involve in depth analysis of single individual, organization, or event. Case studies are used to gain detailed information about specific phenomena. And we have the secondary data analysis. Secondary data analysis involves using existing data that was collected, and then we analyze it for another purpose. Secondary data can come from various sources, as government agencies, academic institutions, or private companies. Okay, types of data collection. Type as follows. We have primary data collection, secondary data collection, qualitative data collection, and quantitative data collection. The primary data collection is the process gathering original and first-hand information directly from the source or target population. This type of data collection involves collecting data that has not been previously gathered. This is the first time recorded or published. Nobody just did this before. Primary data can be collected through various methods, such as survey, on interviews, observation, experiments, and focus group. The data collected is usually specific to the research question or subjective and can provide valuable insights that cannot be obtained from secondary data source. Primary data collection is often used in market research, social research, and scientific research. Secondary data collection, it's a process gathering the information from existing source. Something is already there in the base that have already been collected and analyzed by someone else, rather than conducting new research to collect the primary data. Secondary data can be collected from various sources, as published reports, books, journals, newspapers, websites, government applications, and other documents. We have also the third one, qualitative data collection. The qualitative data collection is used to gather non-numerical data such as opinions, experiences, perceptions, and feelings through the techniques such as interviews, focus groups, observations, document analysis. It seeks to understand the deeper meaning and context of phenomenon or situations, and is often used to social sciences, psychology, and humanities. Qualitative data collection methods allow for more in-depth and holistic exploration of research questions and can provide rich and nuanced insights into human behavior and experiences. We are going to quantitative data collection used to gather numerical, this one, and that can be analyzed using the statistical methods. It's typically collected through the survey experiments and other structured data collection methods. It seeks to quantify and measure the variables, such as behavior, attitudes, opinion, and systematic and objective way. The data is often used to test hypotheses, identify patterns, establish correlations between variables. Quantitative data allow for precise measurements and generalization of findings to large population. It's commonly used in fields such as economics, psychology, and natural science. I'm going to just have something simple to make it like understandable, this data collection and sampling techniques. Okay, the first step to conduct the research is to identify the topics for questions that are to be investigated. So what the topic you want to just choose, and the questions will be like answered, and what do you want from this research. A clearly laid out research question is helpful in identifying what the subjects or cases should be studied and what variables are important. What do you want, which a question you want to ask, and what the subjects are the case are you going to study. It's also important to consider how data are collected so they are reliable and help achieve the research goal. Okay, this is sampling from a population. As I have the population, I want to check, I'll take my sample, and the group, I want to just make my study or research on them. We might try to estimate the time to, like this a question as like I have this example. I'm going to study this specific group, the population, and as I say, like I have here group of graduates from university. So we might try to estimate the time to graduation from Duke undergraduates in the last 5 years by collecting a sample of students. So all graduates here in the last 5 years represent the population, all these students. And the graduates who are selected for a review are collectively called sample. So this, I have a sample here. In general, we always seek the randomly selected sample from population, and the most basic type of random selection is equivalent to how raffles are conducted. For example, in selecting graduates, we could write each graduate's name on a raffle ticket and draw 100 tickets. This as an example. Selected names could be represent a random sample of 100 graduates. Why pick a sample randomly? Why not just pick a sample by hand? Consider the following scenario as I have this students. Suppose we ask a student who happens to be measuring in the nutrition to select several graduates from the study. What kind of a student do you think she might collect? As a researcher, do you think her sample would be representative of all graduates? Perhaps she should pick this appropriate number of graduates from health-related field. So the sample will be like smaller. And instead of all the population, we're gonna select a specific group or perhaps her selection would be well representative of the population as a majority. So we, when selecting the sample by hand, we run the risk of picking a biased sample, even if that bias is unintentional or difficult to discern. And this is the sample, this is a figure, this is a graphic. 5 graduates are randomly selected from the population to be introduced included in the sample. So this all graduates, and this is a sample. And so the difference here, we get, instead of sampling from all graduates equally, a nutrition measure might inadvertently pick graduates with the health-related measures disproportionately often. So here, I have all the graduates here, and this is from graduates from health-related fields, and I took the sample from this specific group. So if someone was permitted to choose exactly which graduates were included in the sample, it is entirely possible that the sample could be skewed to that person's interest. This is like interest to the researcher only, which may be entirely unintentional. This introduces bias into the sample. Sampling randomly helps to resolve this problem. The most biased random sample is called a simple random sample, and it is the equivalent of using draft fill to select cases. So this means that each case in the population has an equal chance of being included, and there is no implied connection between the cases in the sample. The act of taking sample randomly helps minimize bias. However, bias can be cropped up in other ways, even when people are picked at random. So, like for survey, caution must be experienced or exercised if the none represent in high. For instance, if only 30% of people randomly sampled for survey actually respond, it is unclear whether the result is representative of the entire population. And this non-response bias, okay, like this. I'm sorry. So a skew can be a result in this as a result of this non-response bias. Another common downfall is a convenience sample, where individuals who are easily accessible are more likely to be included in the sample. For instance, if political survey is done by stopping people working in the Bronx, this will not represent all the New York City. So this is only a special area or region. It's often difficult to discern what subpopulation convenience sample represents. So now we're going to see how to collect data. And the following are some steps to consider when collecting data. So we have defined the object, like define the objective, and identify the data source, determine the data collection method, develop a data collection plan, test the data collection process, and collect the data, analyze the data. Define the objective. Before you start collecting data, you need to define the objective of study. And this will help to determine what data you need to collect and how to collect it. So identify the data source, identify the source of the data will help to achieve your object or objective. These sources can be primary source, such as survey, interview, and observation, secondary sources, such as books, articles, and databases. So determine the data collection method. Once you have identified the data sources, you need to determine the data collection methods. This could be through online survey, phone interviews, face-to-face meetings, develop data collection plan, develop plan that outline the steps you will take to collect the data. And this plan should include the timeline. I'm sorry. The tools, equipment needed, and the personnel involved. Who we want to involve in this research or data collection. This is the data collection process. You have to test the process before you start collecting data. Test the data collection process to ensure that it is effective and efficient. collect the data according to the plan you develop in step 4, and make sure you record the data accurately and consistently. Analyze the data. Once you have collected the data, analyze it to draw the conclusions and make recommendations. Sorry, this is such a big topic, but I'm just having the points only. You have more to see and to read. So report the findings. You're going to report the findings of your data analysis to relevant stakeholders. And this could be in the form of report, presentation, or publication. And also you have to monitor and evaluate the data collection process. After the data collection process is complete, monitor and evaluate the process to identify the areas of improvement in the future data collection effort. Ensure data quality, ensure that the collected data is of high quality and free from errors. And it can be achieved by validating data of the accuracy, completeness, and consistency. Maintain data security, ensure that the collected data is secured and protected from the unauthorized access or disclosure. It can be achieved by implementing data security protocols and using the secure storage and transmission methods. And follow ethical considerations also. Follow ethical consideration when collecting data, such as obtaining informed consent from the participants, protecting their privacy and confidentiality, and ensuring that the research does not cause harm to participants. Use appropriate data analysis methods, use appropriate data based on the type of the data collected on the research objectives. This could include statistical analysis, qualitative analysis, or combination of both. Record and store data properly. Record and store data in a structured and organized format. This will make it easier to review or retrieve it and use the data in future research or analysis. Collaborate with other stakeholders. Collaborate with other stakeholders such as colleagues, experts, or community members to ensure that data collected is relevant and useful for intended purpose. So we are going to see the characteristic of data collection. Data collection can be characterized by several important characteristics to help to ensure the quality and accuracy of the data gathered. This includes the validity, reliability, objectivity, precision, timeliness, and ethical considerations. According to validity, this should be accurate and relevant to data collected in relation to the research questions or object. Reliability refer to consistency and stability of the data collected, ensuring that the results are obtained consistent over time across different contexts. Objectivity refer to impartiality of the data collection process, ensuring that data collected is not influenced by biases or personal opinion or data collectors. Precision, degree of accuracy and detail in data collected, ensuring that the data is specific, accurate enough to answer the research questions or objectives. Timeliness refer to the efficacy and speed with which the data is collected, ensuring that the data is collected timely manner to meet the needs for the research evaluation. So we have here the ethical consideration to the ethical principles that must be followed when the collecting data, such as ensuring confidentiality, obtaining informed consent, as I said, from the participant. Okay, we have here the advantage of data collection. There are several advantages of data collection that makes it important process in research, evaluation, and monitoring. This include better decision making. Data collection provides decision makers with evidence-based information that can be used to inform policies, strategies, actions leading to better decision making. Improved understanding. Data collection helps to improve our understanding or particular phenomena or behavior, or providing empirical evidence that can be analyzed and interpreted. Also, the evaluation of intervention. Data collection is essential in evaluating the effectiveness of interventions or programs designed to address a particular issues or problem. Identifying trends and patterns. Data collection can identify trends and patterns over time, indicate changes in behavior or outcomes. That we can you'll see it as in the population, and increase accountability. To increase it by providing evidence can be used to monitor and evaluate the implementation and impact of policies, programs, and initiatives. And the validation or theories also test hypotheses and validate theories, leading to better understanding of the phenomenon. Also improve the quality. It's used to improve it by effort to identify areas where improvements can be made and measure progress toward achieving goals. And the last one we have here, the limitation of data collection. There's something that limits our data collection methods. While collection has several advantages, it also has some limitations must be considered. It's like bias. Data collection can be influenced by biases and personal opinions of data collectors, which can lead to inaccurate or misleading results, and sampling bias also, and not be a representative of the entire population, as I said, resulting in sampling bias and inaccurate results. And the cost can be expensive and time consuming, particularly in large scale studies. And limited scope, data collection limited to the variables being measured, which may not be captured the entire picture or context of the phenomenon being studied. And also we have ethical considerations, and data collection must be followed by ethical principles to protect the rights and confidentiality of the participants. And this can limit the types of data that can be collected. Also, we have the data quality issues. This result in data quality issues such as missing or incomplete data, measurement errors, or inconsistencies. Limited generalizability that may not be generalizable to other context or population. That limits the generalizability of the findings of the data, and at that time it will be limited and it's not good data. So that's all for the variables and the data collection method, and it's all in this few points. I hope it can help you in your data collection and topics and researches. Thank you so much.
Thank you, Dr. Kholood. Thank you so much for your presentation. Okay, so our next topic today on our agenda, we have vision loss in older adult, that presented by Dr. Mazar, Mohamed, and myself. So Dr. Mazar, are you ready?
Yes, I'm ready. Can you hear me?
Yeah, we can hear you.
Okay, thank you.
You can share your screen.
Yes. Are you able to see my screen now?
Yes.
Okay. Hello, everyone. My name is Dr. Mazar Mohamed. I'm gonna present the visual loss and other eye conditions in elderly. So first, our objective is to be able to describe the leading causes and pathophysiology of visual loss and the techniques for preventing and treating visual loss, the signs of and treatments for common eye disorders in older people, and the techniques for low vision rehabilitation. The common eye conditions we will cover is the causes of visual loss, which are refractive errors, cataract, age-related macular degeneration, diabetic retinopathy, glaucoma, ischemic optic neuropathy, and also low vision rehabilitation strategies. The visual loss can be a visual impairment, which is defined as acuity less than 20/40. The prevalence increases with age, affect 20% to 30% of those aged 75 years and older, or blindness, which is defined as acuity less than 20/200. The prevalence is 2% of those aged 75 and older. 50% of blind population is aged 65 and older. The American Academy of Ophthalmology recommends comprehensive eye examinations every 1 to 2 years for people aged 65 years and older. So in older adult, 1 second. The common presentation here is red eye, ocular swelling or discomfort, diplopia, sudden loss of vision, floaters. Those are the common eye complaints. Here we should ask the patient, has your vision changed? Because the decreased vision can indicate a serious condition. We have to check visual acuity and check for afferent pupillary defects. Here are common conditions that require an emergent referral to ophthalmologist. From them is retinal detachments. The symptoms and signs are flashes, floaters, decreased vision, curtains over vision, angle closure, acute angle closure glaucoma. Symptoms are eye pain or headache, ocular hyperemia, hazy cornea, fixed dilated pupil, decreased vision, nausea, and vomiting. Also ischemic optic neuropathy. A patient will complain of sudden loss of vision, can be complete or partial, in one eye, a swollen optic nerve. Also central or branch artery occlusion and giant cell arteritis. Here, the patient complains of sudden painless loss of vision in one eye or in superior or inferior hemifield in case of branch occlusion. If from giant cell arteritis, then review of symptoms may reveal jaw claudication, headache, transient diplopia, and others. Artery occlusion requires stroke protocol within 2 weeks of event. Also, one of the conditions that require emergent referral is retinal vein occlusion. Symptoms are sudden painless vision loss, diffusely if it's central or in one eye, in one hemifield if only one branch vein involved. Prominent retinal hemorrhage and cotton wool patches can be seen on fundoscopy. Scleritis, eye redness, severe pain and or tenderness, decreased vision associated with autoimmune disease. Anterior uveitis, here we have photophobia, eye redness, and decreased vision. Posterior uveitis, floaters, and decreased vision. Corneal ulcers, symptoms are eye redness, pain, decreased vision, and corneal infiltrate. Herpes zoster ophthalmicus, eye redness, pain, burning, rash, decreased vision, light sensitivity, and characteristic skin lesions known as Hutchinson sign. Also, the common eye condition seen by primary care providers are red eye in conditions of subconjunctival hemorrhage. And the treatment is going to be supportive treatment with artificial tears. Also dry eye, treatment with artificial tears and cyclosporine eye drops. Blepharitis, lid scrubs, ophthalmic antibiotic ointments at bedtime for the eyelids, and oral doxycycline. Lid malposition or lid exposure, ocular lubricant, and we may refer for surgical repair. Allergic conjunctivitis, cold compresses, allergen avoidance, and we can use topical and systemic antihistamines. In case of viral conjunctivitis, we can treat with supportive treatment with artificial tears, and we may refer to ophthalmologist if vision significantly affected. Chalazion, we treated with warm compresses, and we may refer for excision. Herpes simplex keratitis, treat with trifluoridine eye drops and refer to ophthalmologist. Herpes zoster ophthalmicus, tear drops, and refer to the ophthalmologist. Angle closure, glaucoma, acetazolamide, oral or IV, and refer immediately to the ophthalmologist. Also, here we have conditions that commonly seen also by primary care providers, like floaters or flashes. And here we need to refer to ophthalmologist immediately because it may be retinal detachment or vitreous hemorrhage. Also in case of sudden decrease in vision, we need to emergent refer to ophthalmologist, and because it may be secondary to a number of vision-threatening problems. In case of diplopia, which can be monocular, caused by refractive error or cataract, or binocular, which can be caused due to microvascular infarct due to infarct to cranial nerve and giant cell arteritis or compressive tumor. So these conditions need an emergent referral. Here we have keratitis, one of the conditions. Tear production decreases with age. And it's characterized by redness, foreign body sensation, and reflex tearing. Management include artificial tears during daytime and ointment at bedtime. Also, we can treat with topical cyclosporine eye drops in severe cases to treat underlying inflammatory causes, and we treat accompanying blepharitis. 1 second, please. Here we have some lid abnormalities. Common among lid abnormalities are common among older adults because the elasticity and tensile strengths are gradually lost with age. Blepharochalasis, which is drooping of the eyebrow, and blepharoptosis, which is drooping of the eyelid, may cause cosmetic deformity, and if it's severe, it can impair vision. Lid ectropion or entropion may cause discomfort. We can treat it with various surgical procedures. In other conditions, herpes zoster ophthalmicus, which is a painful reactivation of varicella zoster virus. It's characterized by dermatomal distribution of weeping vesicles affecting the ophthalmic branch of the trigeminal nerve. We can see the Hutchinson sign, which is a lesion on the tip of the nose. We can treat with oral acyclovir or famciclovir to shorten the course. If there is post-herpetic neuralgia, which may be debilitating, we can treat it with local ointment like capsaicins and lidocaine, but not in the eye. Or we can treat with systemic medications like narcotics and tricyclic antidepressants, gabapentin and pregabalin. Also, we have refractive errors, which is the leading cause of visual impairment worldwide, along with cataracts. Treatments include eyeglasses, contact lenses, and laser refractive surgery. One of the conditions are emetropia, which can be classified into myopia, hyperopia, and astigmatism. Also presbyopia, which decrease inability to focus on near objects. Presbyopia begins after age 40, and it's caused by gradual hardening of the lens and decreased muscular effectiveness of the ciliary body. Cataracts is another condition. Symptoms include increase in glare and decrease in contrast sensitivity, decrease in visual acuity, change in color perception. The risk factors are increased age and decrease in vitamin intake, light exposure for UV light B, smoking, alcohol use, and long-term corticosteroid use. Diabetes mellitus is also a risk factor. Here we can see in the graph the percentage of population with cataract, which are 20% of population aged more than 65 years and 50% of population aged more than 75 years. Last condition here is age-related macular degeneration.
I think you missed one of
no, I missed
slides,
one slide. Yes, sorry. Yes, here's a treatment for the cataract is surgical extraction. 90% of patients achieve vision more than 20/40, and 3 million surgeries are performed annually in the US. The procedure is through local or topical anesthesia, small incision, sonographic breakdown and aspiration of the lens, finally a placement of an artificial lens. Okay, and here we have the age-related macular degeneration condition, which is the most common cause of irreversible blindness among older adults in developed world. Risk factors are age, genetics, smoking, and hypertension. Diagnosis depend on the presence of drusen in non-exudative form or in choroidal neovascularization in the exudative form. The treatment is through vitamin C, vitamin E, zinc, lutein, and zeaxanthin to decrease the risk of neovascularization in non-exudative form, and intravitreal injection of vascular endothelial growth factor inhibitors to treat neovascularization in exudative form. Here we can see the resolution of submacular hemorrhage after intravitreal anti-VEGF therapy in patients with neovascular macular degeneration. I'm gonna stop here, and Dr. Nafisa will continue. Thank you so much.
Thank you so much, Dr. Mazar.
You're welcome.
Okay, I'm going to share my screen. Could you please stop sharing so I can share?
Okay.
Thank you.
You're welcome.
You're still sharing. Dr. Mazar, do you hear me? Thank you. Are you able to see my screen?
Yes, we are.
Okay, thank you. Hi, everyone. My name is Nafisa Mustafa. I'm one of the senior here. I graduated from National Rabat University. So I'll continue talking about vision loss in older adults. I'll start with the diabetic retinopathy. which is it's like a diabetes as well as blood pressure complication that causing damage to the retina, the blood vessels in the retina, which is the light sensitive tissue that at the back of the eye. The epidemiology among people who have type 2 diabetes, at least 10 years, more than 70% show retinopathy, nearly 10% show proliferative disease. So the most important risk factors are the duration of the disease, the control of the blood pressure, as well as blood sugar control. So prevention, that's going to be control of the risk factor, like tight control of the blood pressure and the glucose level. However, that should be individualized for geriatric population. As we know that geriatric population, they tend to have hypotension and hypoglycemia more than higher level of the blood pressure and sugar. That also should be optimized function and cholesterol level. So the treatment available, laser treatment and intravitreal injection, as well as control of the blood glucose and blood pressure. Okay, so we have the stages, non-proliferative, proliferative phase stage, as well as the more advanced, pre-proliferative, and the proliferative. That's a more advanced stage of diabetic retinopathy. So I'll talk first about the non-proliferative stage, and that's it's happened that due to like a weakness of the wall of the small blood vessels, which lead to formation of microaneurysm, and that can damage and can lead to intraretinal hemorrhage, exudate, as well as the formation of the microedema. And the microedema, that's like a fluid buildup. So it's very important to in the microedema phase, that is the like sometimes we know that when there is damage to the blood vessels, we have the all the fluid buildup, and there is some of the inflammatory mediators that can be released, and that's what can lead to formation of the microedema as well as new blood vessels formation. For the pre-proliferative phase, that's lead to multiple intraretinal hemorrhage, venous capillary changes, and intraretinal macrovascular abnormalities, which is capillary shunting, and that can lead to capillary non-perfusion or ischemia. So for the pre-proliferative phase, as I mentioned earlier, that there's going to be release of a lot of inflammatory mediators, and one of them, the vascular endothelial growth factor, which is basically that's modulate the formation of the new vessels. So in order to control that, severe non-proliferative diabetic retinopathy with macular edema should be treated with anti-vascular endothelial growth factor, which is basically a monoclonal antibody. So as we see here in the picture, there is some intraretinal hemorrhage. So that's before the bevacizumab, which is have the brand name for it. I think it's Avista. So here you can see the damage happened and the leakage of the fluid, and that after we use the medication, the leakage actually is controlled. And here in picture C, you can appreciate that there is no more bleeding. The proliferative form, which is the more advanced form, that's when there is new vascularization of the retina, new vascularization of the disc as well, and that's what can lead to visual loss due to vitreous hemorrhage or traction of the retinal detachment. You can see here, there is revascularization of the retinal vessels as well as in the disc, you can see. And here, that resolution of the severe new vascularization, the disc after intravitreal anti-vascular endothelial growth factor therapy in proliferative diabetic retinopathy. So the second topic, we talk about the glaucoma, which is Damage to the optic nerve that often related to high pressure, but glaucoma can also happen with patients with normal eye pressure. Is defined as characteristic optic nerve head damage, which is basically the anterior part of the optic, and visual field loss. That's basically affect more than 2.25 million American 4 years plus years old. It's considered the second most common cause of irreversible blindness worldwide, and also the most common cause among Black Americans. Nearly more than 3 million office visit, it's considered to account for more than 3 million office visits per year. Elevated intraocular pressure is considered the major risk factor, but as we mentioned, many patients with glaucoma have normal pressure. Most common form, we have this, the open angle glaucoma. It's considered the most common form. Is slow, accurate range lead to chronically elevated intraocular pressure. Patients are asymptomatic and may suffer substantial visual loss before consulting an ophthalmologist. So the causes are multifactorial as well as the polygenetic. The other form, which is the closed angle glaucoma or acute closed angle glaucoma, that's due to iris blogging or blogs in the iris, which could be partially or completely block the drain of the angle, and that would lead to perceptual increase in intraocular pressure. And that presents like with dryness and pain with acute vision loss, often headache, nausea, and vomiting. And it requires emergent ophthalmic referral. So management, intraocular pressure lowering medication, that could be local and systematic, aqueous suppressant, aqueous flow facilitators, laser trabeculoplasty. We use also filtering surgery, plus or minus anti-metabolite, brain device, and ciliary body destructive procedure. The next topic that anterior ischemic optic neuropathy. It's a microvascular occlusion of the blood supply to the optic nerve that due to either atherosclerotic vascular disease or inflammation, for example, temporal arthritis. That's result in acute vision or field loss. Okay, so that's we have like the anterior part of the optic nerve, and as we know that it's called the optic nerve head. So that's pallid swelling of the optic nerve head in the older adult patient with anterior ischemic optic neuropathy, as you can see, the swelling, and that you cannot appreciate even though. Lastly, we have Charles-Bonnet syndrome. It's characterized by visual hallucination experienced by patients with significant visual impairment. Maybe elementary shapes or complex, such as like children, like humans, animals. Patients have a clear sensorium and are aware that vision are not real. So the criteria for this syndrome, it could be that the patient have visual impairment with a visual acuity around 20 or less than 20 over 40. Without auditory component or delusion contrast. So the patient is completely aware of that those hallucinations are not real. So the treatment for this case, that it's just the patient usually require assurance that they're not crazy, and some patient that we can use for them anti-seizure medication. Okay, so for the rehabilitation is available for patients with acuity less than 20 over 60, improve lighting and provide reading material with bold and large font and attenuated black on white contrast. Magnifications like high plus spectacles, magnifier, closed circuit TV, as well as telescopic devices. Eccentric viewing for patients with age-related macular degeneration with central macular pathology. So that's basically training them to use off-center fixation. Talking devices or primarily for those who have lost vision altogether. Smartphone apps can provide magnification, money recognition, and dictation functions. Chosen wisely, do not perform preoperative medical tests for eye surgery without the specific indications. Most cases of acute conjunctivitis have a viral etiology. So for that reason, do not treat viral infection with antibiotic. If diagnosis is uncertain, patient may be followed closely for resolution. Do not place temporary or permanent punctal blocks for mild dry eye syndrome before trying other medical treatment. So summary, that visual loss occur commonly among older adults and may lead to reduced quality of life, high medical care costs, as well as loss of independence. So for those reasons, primary care providers should be routinely screen older adults for visual loss. The treatment options are available for many types of visual loss, as we mentioned clearly earlier. So today we have 3 cases, if you'll be ready with me. The first case, an 84-year-old man is brought to the office because of his right eye is red. He seems to have cold and is sneezing. There is moderate watery discharge. He says that the eyes feel gritty but does not itch. He has no eye pain or sensitivity to light. There is no baseline information or visual acuity, but he thinks his vision is unchanged. Nursing home staff confirmed that there is no evidence of change in vision. Medical history, Alzheimer's disease. On examination, eye movements are intact. There is moderate bulbar conjunctival injection of the right eye. Conjunctival hemorrhage extend from 6 o'clock to 9 o'clock positions. Right preauricular lymph node is slightly tender. So which of the following is the most appropriate management of the red eye? Antibiotic eye drops, referral to an ophthalmologist, artificial tear as needed, antihistamine eye drops. You can tell me in the chat. Yes, so most of you got it correct. That's basically we start with the artificial tear as needed. The second case, we have a 9-year-old woman is considering whether to have cataract surgery. She's able to read large print books on her iBook reader and solve crossword puzzles, 2 of her favorite activities. She has bilateral with age-related macular degeneration and received antivascular endothelial growth factor. The left nuclear-sclerotic cataract has worsened, and vision in her left eye has decreased from 20/40 to 20/80, but vision remained 20/60 in her right eye. She's frail. She moved to a nursing home from assisted living 1 year ago when she began to need assistance with bathing, dressing, as well as toilet. History, age-related macular degeneration, aortic stenosis, percutaneous aortic valve replacement that 2 years ago, asthma, and osteoarthritis. Which of the following is the most likely outcome from cataract surgery? More rapid progression of age-related macular degeneration in the left eye, correction of vision loss in the left eye, improved ability to read and solve crossword puzzles, better monitoring of age-related macular degeneration. So outcome from cataract surgery. Perfect. Most of you, the correct answer is D. But some of you also use C, improve ability. And that's actually, for me, it was like, that's what crossed my mind first. But as we know that age-related macular degeneration, it's a progress disease. So all the time need to be monitored. Last case, we have a 75-year-old man is seen for routine follow-up related to diabetes mellitus, which is not under optimal control. It's apparent that his right eyelid is drooping. He said that he has been aware of the droop for the past few months, but is not bothered by it. He has no double vision or blurring of vision. He has not noticed any difference related to swelling on the right side of his face. There is no new muscles weakness or pain. On examination, the right upper eyelid covered the cornea almost to the pupil. The pupils are equal, round, and reactive to light and accommodation. Extraocular movements are intact. The eyes are aligned, and his face is symmetric except for the lid creases. Okay. Which of the following is the most likely cause of the piliform ptosis in this patient? Prolapse of the orbital fat band, Horner syndrome, third nerve palsy, levator dehiscence. So the causes of his piliform ptosis. You're right. So that's the levator dehiscence. That's the correct answer, D. Thank you. We conclude our presentation for today.
Thank you so much, all of you. Good presentation, excellent. Any questions regarding this presentation or the previous one, or any comments? Thank you. We can go to the next one.
Thank you, Dr. Nari. So the next topic today, using Excel and Google Sheet for questionnaire collection of data that presented by Dr. Israa Hassan. Israa, are you there?
Yes, I'm here. Can you hear me clearly?
Yes, we do.
Okay, great.
We can
Hello,
start
Dr.
sharing.
Nader. Hello, everyone.
Hello.
I hope you're all doing well and your families are safe back in Sudan. Can you be sharing my screen? Okay. So my screen is visible, right?
Okay. It is.
Okay, great. So I'm Dr. Israa Hassan. I am from Sudan, graduated from University of Khartoum 2017. I'll be presenting the topic of using Google Form and Excel sheet for data collection. This is a part of the Telegeriatric Research Fellowship developed by the Michigan State University. So these are the topics we're going to discuss. Why to use Google Forms, how to create a Google form, and then how to share the form after we created it and to collect the responses. And finally, we have tips for creating effective Google Forms. Okay, so why to use Google Forms? Firstly, it is free. It's a free tool, and it also enables you to do data collection from a large group of people very quickly and easily. You just create the form, copy the link, share it, distribute it in the social media platforms, and or any targeted group of people. You might also share it in the hospital, and you get your responses very quickly. It's also flexible. You can customize your forms in different types of with different types of questions, themes, images. You can make it visually appealing for the respondents. And finally, it can be easily transformed into spreadsheets for data analysis, including Google Sheet or Excel sheet. And in the following slides and in the live tutorial, I will show you how to transform the responses into Excel sheet. Okay, so we have the steps of creating a Google form. This slide is just for capturing it. Just take a screenshot if you'd like, and if this is the first time you are using Google Form. But I will take you through the steps of creating Google Form and through my my browser. Okay, so feel free to ask me any questions. Stop me at any time that you need further clarification or any explanation, and I will stop and explain it more for you. Okay, so you will start by opening Google Forms. Just go to Google and type Google Form. Search for it, and then in the results you click on Google Forms.
I think we are still on the screen.
Oh, I'm sorry. Okay.
So if you can unshare and then share the screen.
Okay. Okay, now you can see my browser, right?
Yes.
Okay. So you just open Google and type Google Form. And from the results, just click on Google Forms. If you're not signed in already, it will require an account, a Gmail account. So you can sign into your account, and then you can click on this button, blank, to start creating your form. I have created one already for you, so you can we can minimize the time. Here I have created an example of a form regarding health insurance for geriatric population. I just typed the title, and then I typed a description for this form. This is part of Michigan State University Geriatric Research Project. All the information will be confidential and used for research purpose only. You are free to use whatever description you would like. And then you start by adding questions for your respondents. This is the button for adding questions. This is plus button. Just click on it. You can add the question. Here I have typed, do you agree to participate? This is from the as an ethical part of the data collection. And option 1, you can type yes. Add another option, type no. And here you can edit if you want the question to be required, so the participants will not go to the next question without answering this question. You just turn this on, make it required, and then according to your to the question you have typed, you can choose whatever answer you want. You wanted short answer, you wanted a paragraph, multiple choice, as in our example. We have picked multiple choice, so it is yes or no question. And from these 3 buttons, more options, if the participants doesn't want to participate in this research, so they should go to the end of the form. So when you click on this, you can choose go to section based on answer. So if the participant has chosen yes, then can go to the next section. But on this one, we can edit it and make it just submit form. So the cannot continue answering further questions. So the next question, we have gender. Also, we use the type multiple choice, as we have only 2 genders, female or male, or other types. Okay, and then we have the job. Here, we can use short answer instead of multiple choice. It will be lots of choices if we chose multiple choice. So it's better to make it a short answer. And then we have the annual income. We can also make it in a range form or make it a short answer. It's up to you, but it's gonna help if you make it a multiple choice. Right here, I've typed medical history. So I found that maybe this is not very clear to the respondents. So we can add a description for the question. The description also can be added from here. You can add it, you have the option of adding a description. So you can tell the respondents that we are looking for the chronic diseases, whether the respondents are receiving treatment for them or not. And then we start typing the options for them: hypertension, diabetes, and whatever chronic diseases that you are that are being covered with the insurance. You can organize your form by making sections. You can make some questions in one section that they are of a similar purpose. You put them in one section, and then you make it. You make another section. You can add it by here. This button right here. If you click on it, a section will be added. You will type a title for this section, and then you can again add questions to this section with the same idea. Click on here, add a question, type it, choose a type for the answer. If it's multiple choice, then you can add it. We have the option of checkboxes. Checkboxes would have been suitable for something like medical history, because some respondents might have many multiple chronic diseases. So at this option, we can add checkboxes, hypertension, diabetes, and the respondent can pick them all or many of them at the same time. Okay, are we clear so far? Do you have any questions?
No, carry on. It's clear.
Okay. Great.
Sorry, can you repeat how can we give the person how to choose multiple choice, not just one?
Yes, by the question you choose check boxes, and instead of multiple choice you choose check boxes, like here.
All right, thank you.
Yeah. Okay. So after you finish adding your questions, then you go to the next phase when you make your form more visually appealing. Right here, you can customize the theme. You can change the text style for the header, for the questions, and then you can choose a header as an image. You can choose from either from the gallery on your computer, or you can choose one of those that are ready, and then you can change the color of the theme of your form, so you can make it more appealing for the respondents. And after you finish, you click on the preview to check how is it going to appear for the respondents. You look at it. You go to the next page. I cannot go because the questions are required, but you can try and see how it is looking from the respondent side. Okay. Here we have also the settings. You can also change the settings for the form. If you want the responses to be to collect the email addresses for the respondents, then you can change it from here only for verification, or you actually need their emails, and it will be written on the outside. Here you have many options to explore. Also, if you have other collaborators in your team and you want them to edit, participate in editing or checking the responses with you, then you can add collaborators from those 3 points right here. You click on them and then you can add a collaborator. You need their email to do that. After you click on add collaborator, then you can type their email. They will receive an email that they can now collaborate on your form. They have an access for it. After you finish and you're sure that you can now distribute your questionnaire for the respondents, then you can create a link. I'm sorry. You can send it, either through email or using Facebook, Twitter. Those are the options to share your form, or you can just copy the link from here. Or if you have a website, you can use this one to embed the link on your website page. So you can just copy this link, or you can make it a shortened URL. This is very short. Make a copy of it, and then you can paste it on whatever you want, on WhatsApp, Facebook, or anywhere. Following that, you will receive the responses right here. I have an example of previously work done by me. So the responses will appear, there will be automatically analyzed by Google Form. You can, this was a feedback form, so it was easy for us visually to estimate the satisfaction of the respondents. And if you have a research, so you will not need those, you will need to transform it into a spreadsheet right here. So you have to click on view in sheets. When you click on that, it will be transformed, all responses will be transformed into a spreadsheet. Here will be a timestamp, but we have changed it for analysis purposes. And then if you want to save it as an Excel sheet instead of Google Sheet, you click on File, and then you download as Microsoft Excel. That's how you get an Excel sheet. And from there, you can analyze the data and do all the graphs and edit it right here. It is now saved as an Excel sheet instead of Google Sheet. Okay. Are we clear so far? Am I being clear?
Yes.
Yes, very informative. Yes.
Okay. So finally, we have some tips for you to creating an effective Google Forms. So to create an effective Google form, it is important to consider your audience and goals. Make sure the questions are clear and concise. Avoid using jargon or technical language that may confuse respondents. You should also consider the design of your form, including the use of images, colors, and fonts. And finally, be sure to test your form before sharing it to ensure that it works properly and it is user-friendly. I will also share some useful YouTube links. They were already shared on the Glide app, but I will share them again on the WhatsApp group. So you can take a look. If you forgot anything or you need a further clarification, you can watch the YouTube videos or you can contact me directly. You are welcome at any time. So that concludes my presentation. Thank you.
Thank you so much. This excellent presentation and tutorial. Thank you.
Thank you. Thank you, Dr. Nadir.
You're welcome.
Thank you so much, Dr. Israa. It's very informative. So our next topic in the agenda, we have how to develop a mobile app from scratch, and that's presenter Dr. Mafaz and her team.
Hello, good evening, everyone. Hope everyone is doing good. This is Mafaz. I'll be speaking about how to make an app on Glide app from scratch. Okay. So for today, we're going to be using a website called Glide. It's a website or online-based app maker or developer. For today, I thought about an app idea, which is fall risk assessment. It was discussed before a couple of months ago by Dr. Nader. So I was thinking, since there are so many people interested in medicine and physiotherapy, it would be a very good idea to kind of discuss this. In order to make an app on Glide app, we will need an Excel sheet. Okay, so there's going to be two parts for this app. There's going to be a part for the assessment and a part for the educational part. For the assessment, we will need to ask the users for their age. To assess the risk, we'll need to know if there's history of falls, there's history of comorbidities, and then we can assess if there's a high risk or low risk of falls in the future. So I'm going to be opening my Google Sheet. I'll create a new one from blank. Okay, so in order to make our questions, which are going to be choices, we're going to need to make our first question in the first sheet. We're going to name the first cell question 1. Be question 1, and it will be age, or we can say, what is your age? And then our question 2 will be, there is history of falls. And then question 3 will be, there is history of comorbidities. And our third question, or it will be our answer, will be the fall assessment, fall risk assessment. So these are our questions. Now we need to make a sheet for our choices, which are going to be the age, from which range to which range, if there is a yes or no for the falls, a yes or no for comorbidities, and a risk for fall, which is low risk or high risk. So we're going to add a new sheet. It's going to be sheet 2, and we're going to add, for our first question, the age. I thought about age ranges from less than 65 _ more than 65, and then you go to the sheet under it. And our first range is less than 65. The second range is more than 65. And then the other question is the risk of falls or history of falls. Yes to be a yes or no question. So yes.
Column 1, can you add the header
Here?
No, the cell number 1A1, instead of this, put them down, and then here put the age answer.
Age answer.
So this will be the selection for the. You can stop. Yeah. Okay. Thank you.
So the other question, the history of falls will be yes or no. Will be yes or no. And then our comorbidities will also be a yes or no, or if we can change it accordingly, could be like Alzheimer's or hypertension or diabetes. But for today, we can go with a yes or no question. And then our assessment can be low or high. And then over here, we will say low risk, and then high risk. So with this now, we have made a question and its choices. For the app, since we have a yes or no, we need at the end either a yes or a no or a less than 65 or more than 65. So we're going to go to our first sheet where the questions is, and we're going to add our answer one, which will later on the app is going to add from the second sheet, either yes or no, or the age less than 65 or more than 65. So I'm just going to label them for the app. Answer 3 and answer 4. So we have the age, the yes or no for the fall, and yes or no for the comorbidities. And then for our risk of falls, it's either going to be a low risk or high risk. So we can add here low risk. And answer 5 will be a high risk. Later on, we can add a specificity for the visibility. So we can add that according to the age, according to the risk of falls, according to the history of morbidity, the answer will either be visible as low risk or high risk. Okay, so now we have made the Google spreadsheet. We can name it Fall app. Okay, now we're going to open our Glide app. Okay, so the app doesn't ask very much, it just asks you to log in. And once you log in, you'll click on New Project. And then it will ask you to name your project. So I'm going to name it Fall Assessment App. And I want it to be as a mobile view when I create it. So we're going to say continue. Our information is on a Google Sheet. So I'm going to choose Google Sheet from the Google Drive and continue. Now my all my Google spreadsheets are here. So the one I chose is the Fall app, which we just created. So we selected. So the app by itself, it tries to fill in for us, but we're going to remove our sheet 2 here. Hold on, let me move this. Okay, so we're going to remove sheet 2. And then we have sheet 1. So we don't want it to be viewed like this. So we're going to remove the fields. We're going to remove the title. We're going to add it individually by ourselves. So we're going to add a simple title. And then that's our question 1 from our source, which is the first question. And then for this, we need a choice. So we're going to go for we click the component. We search for choice. And then our choices is in sheet 2. So our source would be sheet 2. And the value is age. So age answer. I'm going to change the style so we can see it rather than the drop down. We can choose the chips, or we can choose the radio button. I'm going to go with chips. And then when we want that, then when the person clicks on less than 65 or more than 65, you want the answer to be written to be answer 2, which is sheet 2, which is in sheet 1, excuse me. So when the user chooses less than 65 or more than 65, it's going to be automatically added into our Excel sheet as less than 65, but to be here as an answer to the first question. This we can, as we fill the other questions, we can later on check it out in the Excel sheet. So this is our first choices. The label over here, if we don't want the answer 2 to be visible, we can remove it and easier like this. And it's just now, what is your age, less than 65 or more than 65? and the answer is written to answer 1. Now the other title, we choose simple title. We go to our second question. And then we go to our components and we choose choices. Okay, and our choices are in sheet 2. And it is in sheet 2, and the value is yes or no. And we want it to be written into the answer 2 column in our sheet 1. And again, I'm going to change the style to a chips so it's more visible. And I'm going to remove the second label, the label to be empty. Okay, is there anyone that wants to help me to add the third question?
Third question was about the comorbidities.
Yes. So what am I going to add? Am I going to choose the which like am I going to choose a title, or am I going to choose a collection or layout to add the question?
I think we
Simple.
choose the layout.
We add simple.
Yes. So
Yeah,
we're going to add a
okay.
simple title. That's for our question. We choose simple title, and then it automatically helps us. So it said question 3, the comorbidities. Now I want to add the choices. So what am I going to do?
Components.
Yes.
And then type choice.
Yes.
Yes, can click on choice.
And then it says that my source is in
Sheet 3,
sheet
I think.
1, sheet 2. That's where my
Sheet 2,
answers
yes.
are. Yes. And then I'm going to change my value. A yes or no for the comorbidities. And then like when the person chooses the answer, I want it to be added to my first page. So it's going to be written to answer 3. Yes?
Yes. And then delete the label.
Yes. Delete the label and change the style so it's easier to be seen. Is there anyone else that wants to help me with the fourth question?
Can I ask a question, or after you finish?
Yes, go ahead. No, go ahead.
I'm just confused with the source, or which comes first, when someone opens the app and then he answers the questions, and then it goes to the spreadsheet. Am I right?
Yes.
Okay, so how is the source is sheet 1? I don't understand what is the difference between the source and then the value. I think you add.
So let's
Yes.
look at the Excel sheet. So our first, the sources is the sheets. So sheet 1 is my first source and sheet 2 is my second source. So in my first sheet, I added my first source. Basically, I added my questions. So what is your age, the falls and the comorbidities and the assessment, the full risk assessment. In the second sheet, my second source is my choices.
Okay. Yes. So the answer will be added to the.
So the answer will be added to my first sheet, answer 1, under answer 1, answer 2, and answer 3.
Okay, as a yes or no, or as the answer itself?
It will be added as according to which question it is. So if it's age, and under answer 1 it will be less than 65 or more than 65.
Okay, so why we created a sheet 2 if the answer would appear on sheet 1?
Because
I'm just confused.
Yes,
okay.
So the app, it doesn't read the first question and answer on the same page, or the choices, or the question and the choice on the same page. So it needs the question on a different page and the choice on a second page. But then it will take the answers of the choices and it will add them to the first sheet.
Okay, I'm starting. Okay.
So it's just think about like this first sheet, it has my question and answer, but my choices, which are the answers, are in the sheet 2. And the app will take the choices and add them to the answers in the first sheet.
Okay, so in the
Can I
history
interrupt?
Yes,
Can I
yes, go ahead.
interrupt?
Yes.
Yeah. So basically, if you remember what the previous talk was about, the forms, Google form.
Yes, the Google form.
It's basically a spreadsheet like the one we are looking at now, right? The data will be collected in this format, but you want the user to look at the form and use the form to answer your questions. So you have two documents, if I may say. One of them is the spreadsheet that we are looking at, and then the user has a page where in the previous talk, we presented the form where they have the option. Israa went to question 1 and the options and the selection and whatever. So to make it easier in the app development, they want you to use the same method. So you think about what your data will be set in, and then what the user will get as a page where they can click or select or whatever. So the options for the user, it will be in a separate sheet for the program to work well, and the data or the answers or the information that will be saved, it will be saved in this spreadsheet. This is why you need sheet 1 for the data or the question and the answers, and sheet 2 to list the options or the choices for the user interface. Similar to the form, Google form. When you create Google form, the user will look at the form, but the data, when they click on it, when they submit, it will go to a sheet, Google Sheet, where they will be saved, the data will be saved. So you think about it the same way, if that makes sense.
Okay, yes, it makes sense. Thank you, Doctor. Thank you, Dr. Nader.
Okay, so now we're going to add our 4th question. It will be the same way. Does anyone want to help me with the 4th question?
Okay. We will go to add a title.
Yes.
Simple title.
And it added it for us. Question 4, the full risk assessment.
Okay.
So now we want to add, yes. For the last question, it's not a choice anymore. It has to be either low risk or high risk. Yes. So now we're going to add the choices, the low risk or high risk, but we're going to add them as text rather than choices. So we're going to go to our component.
Component and type choices.
No.
No.
Yes. We're going to type text.
Okay.
Text. And then I'm going to go to my answer 4.
4.
Yes, and this is low risk. Can you help me add the high risk?
In the same way, or?
Yes, the same way.
Same simple.
Okay, in component and text.
Yes, going to search text. And then
I'm
going to
you'll go to answer 5.
I click on text and yes, and then I go to my answer 5, and that is my high risk. So this is we added everything, but now it doesn't work efficiently because now it doesn't really help me to assess the patient, right? It doesn't give me the answer, like is it high risk or low risk for the patient. So I can go to my, yes, I can go to my 4th or last question. For example, my low risk, I can go here and go to my options and say that I don't want this answer. I want this answer to be visible only when my patient is less than 65 and he has no risk of falls and no comorbidities. So I'm going to come here to the visibility, which is I basically chose my answer, low risk. I went to options.
Mafaz,
Yes.
can I interrupt? Can we pause here and see
Yes.
if there is any other questions? Because this is kind of a little bit the next step of the programming or the thinking of the development of the app. So the first step is to lay down what you just did, Mafaz, is laying the display for the user. So whoever wants to use this app, it will show them, display this image or this page with all these questions. Now comes the interaction. You want it to be dynamic or moving, showing some component according to the answer. Same way the forms, remember, Israa was mentioning first question, do you want to continue or answer this question? If yes, they will continue with section 1, section 2. If they say no, it will take them to the end of the form. So this is depending on what answer the user will click. The form will take them to which section. Here, the same. It depends on what the answer will select, what the user will select from the answers. Then we want to display certain things and hide certain things or something like that. So we want to just play with the component according to what the user give us as answers, if that makes sense. And now, Mafaz, you can continue.
Yes. So now I want that my low risk for fall assessment would be the people who are less than 65 and those with no history of falls and no history of comorbidities. So I chose my answer, the one that I'm interested in changing now, the low risk, and I go to my options, so which is the visibility. I add conditions, and my first condition is that show the component when my answer 1, which is age less than 65 or more than 65, my answer 1 is less than 65. And then it gives me and or, so I can go with and. My answer for 2 is no. There is no there's no history of morbidity. There's no history of falls. So I add no. And then I go for the other one. The last one is answer 3, which is history of morbidities and is no. So now my answer should be visible only when the first answer is less than 65 and the answer for 2 is no for falls, and answer number 3 is no for comorbidities. Okay, so now let's test it. If I choose less than 65 and I choose there's no history of falls and no comorbidities, my low risk appears. But now I still have my high risk. So I'm going to unclick the criteria for low risk. Now, can anyone help me change the visibility for the high risk?
Yes, I can do that.
Yes.
Okay, so I will click on high risk and then
Yes.
Choose options. Add yes, invisibility, add condition. Oh, okay. Question answer 1.
Yes.
Choose answer 1. And then is. And then write more than 65. Add condition. Answer 2 is yes. And then add condition. Answer 3 is, and then yes.
Yes. So now let's test this one. We said that the age is more than 65 and there is history of falls and there is comorbidities and it says high risk. Yes. So now we change the visibility and this is how the user, if they have according to their situation, if they have if they're less than 65 and they don't have history of falls and no comorbidities, they are low risk, and if the opposite, they will have a high risk. So this is the part for the assessment itself. So now we can change the name. Instead of it appearing as sheet 1, I can go to my Excel sheet and change the name. So it is, rename it as the assessment. So now I changed something in the Excel sheet, the main Excel sheet. So in order for it to be synced to my data on the app, I need to go to data and I need to sync it. Sometimes it's done automatically, but sometimes you have to redo it so it doesn't affect your work on the other side. So now it changed to assessment. I'll go to my list.
Excuse me, Dr. Mafaz.
Yes.
I want to add something. If I want to do an options like high risk option, there is any option to add what's the specific problems and how to resolve it. For example, after fall risk assessment appear high risk, then I would like to add some option like if this elderly person have a visual problem, make a choice of please test your vision, or if there is any osteoporosis, please take vitamin D plus calcium. I mean to be more advanced.
Like an education part, or is that what you mean?
No, I want to just to understand if I want to add some options and there's a high risk option. Do you understand me?
After the user gets a high risk answer?
Yes.
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 You want what exactly?
Yes, I want to add some options or yes, under high risk.
Yes.
Like if there is any problem in your vision, if there is any problem on your hearing, to add subtitles under high risk.
Okay, so
do you understand me?
Example, so let me say it back to you so I get it. This is the answer you mean. So if my patient gets a high risk, you want that a new choice appears that says, do you have visual impairment? Yes?
Yes. Yes.
Okay, so this means that yes, that's it, right?
Yes, according to his main problem, I can make an option to resolve this problem.
Okay, so two choices would be the one for the is there a visual problem, and then if yes,
for
go to the
example,
doctor.
yes.
Yes.
Yes. Yes.
Okay, so now that
my
means,
second question. Okay,
yes.
how to do this? My second question is how to create colors and more visual things to be more visual for persons.
Okay.
Do you get my point?
Yes, yes. So
Yeah,
for the
thank you.
colors, it's in the settings. in the appearance. And you can change the colors. This is what you mean, right?
Yes.
Okay, so this is it can be done easily. We can have it like this, and we can look at this at the end. But let's look at the choices Dr. Ala says that we can do. So right now, if we want to add a question for the visual impairment, is there visual impairment, yes or no? And if there is, then we want to tell the patient to go visit a doctor. So that means we have to go to our Excel sheet. And can someone help me add the 5th question? Okay, so our questions is usually in the first sheet, and the answers or the choice will be in the sheet 2. So I'll add question 5, and that's my, is there visual impairment? So that's my question 5, and then I'll go to sheet 2 and I add my choice. So it's a yes or no. So yes underscore no. Then I say yes or no. And then I have to add in the first sheet a place where my answer, which is the choice, will be added to. So that's my answer 5. Answer 6, excuse me. It will be a yes or no. And then once she's since Dr. Ala said once the person says yes or no, we want to add a visual impairment. So first, let's add the 5th question to our app. So who wants to help me with the addition of the last question here?
Same, we go to like sample.
Yes.
From choices, yeah, sample. And text.
And we're going to
title.
go to title, yes. Okay.
We should think first. I think we should think first because it doesn't show that there is a question 5.
Oh, yes. Very good, Victoria. Let's try to sync it. Sorry for this. Okay. Now, yes, very good. Is there visual impairment? Now we're going to add the choices. How am I going to add choice?
By text.
You would. Okay.
Yes, Dr. Israa.
By typing choices, add component and typing choices. Choice.
And then?
Then go to I think it answer 6. In value questions.
My value.
We add the value. Question 5.
Before the value, I have to change my source because my choice is in sheet 2. So I go to source. I change to sheet 2. And now my values. And it's a yes or no.
Yes or no.
And this is where my answer should go to, answer 6.
Answer 6.
And here I'm going to change my label. I'm going to remove it, answer 1. So it's just a choice. And I will change my style so it's easier to be seen. And it's yes or no. And going to. So now we have the choices. So basically we want that when our answer 5, the high risk, should appear, when my patient gets a high risk, the answer or the 5th question should appear. So that means that I need to work on my question 5 I will click on it and go to my visibility, the options, and I'll give it a condition that says that when my answer, show when answer,
I think you need to click on it first, select.
it's not selected.
Select the question, and then you can go to option.
Oh, yes, need to do another. So now I want that when the question should appear when my answer 5 is high risk.
No, 6.
Answer 6.
No, answer 6 is the
yeah,
visual
sorry.
impairment. Yes.
Answer 4. Answer 4, I think.
Answer 4 is low risk. Answer 5 is high risk. So we want
yes,
this.
answer 4.
Yes, thank you. So answer 5 is high risk. Okay. So now since it's high risk, it appeared, and now, but I also want my choice to be visible when my answer is high risk. So I will go here and add my visibility, a condition that says when my answer 5 is high risk. Okay, so now let's change it to check if it's actually, and I'm just going to sync it. Okay, so now let's see if my patient is less than 65 and he has no history of falls and no comorbidities, he has low risk. But now my 5th question still appears, so that means there's an issue. So let's check what's going on. Component for answer 5 is high risk, and okay.
I think the trick is if you go to the sheet, it already has the answer written. If you go to the sheet, column I and J, they already have. So column J has this one. This is a trick. So it's already answered. So it's gonna show up. So the only option is to get this I2 and J2 into the choice sheet 2.
So we need to remove them, the choices.
Remove them and add them to the sheet 2.
Okay, so we're going to remove them as text and add them as choices.
And those are sheet 2, yeah.
So I'm going to go to my.
Add them to the sheet first, and then you can select them.
It's already added as a choice. I just added them as, yes, that's why. So I'm going to go to the app and choose the history of false. Instead of text, I'm going to be removing the text. Remove the text and add a choice. Okay. So I'm going to be adding choice. And my choice is in the second sheet. And it is high risk or low risk. Change this. And it will be added to the 4th column. So now we have, instead of, yes, hold on. Okay.
You can remove the, yeah.
Yes, so now We'll remove the label. Let's see there. And yes. So now, if my patient is more than 65 and they have a high risk of fall and they have a high risk, my answer. That's the visibility. We have changed the visibility. So now my answer would be an answer 4 instead of 5. And then it's visible, and then I have to change my choice for the visibility, the visual question. So my answer would be in 4 rather than 5. Then it's a yes or no. However, now we don't have the choice for low risk or high risk. It doesn't appear as a statement for the patient.
Yes, which is, it doesn't make sense that the patient will recognize himself as a low risk or high risk. So,
yes, so this means that
there is another way. There is another way instead of doing it this way. So you can go to component plus add the text and then select any text. Yeah. Click on it,
text,
and then
yes.
On the right, this is a text. You can just delete that and go to the first option, custom, first one, custom. And then you can put the text you want, high risk, for example. And then you can go to the options.
Then add
you want to add the other one? That's fine, yeah. The same way, low risk text. And then you can change the visibility for both of them.
Okay, yes. So now I will just remove the choice for the low or high risk. So it just becomes the text.
Or you can undo that, undo. For now, let's keep them. The user will not be able to hit them. Just for the demo, we will keep them so that the answer 4 has some component. But we can show the text according to high risk or low risk.
Yes. With the choice, we can for the visibility, the visual impairment. With the choices, it can be seen, but with the text, it will not be very well done. But for this, I think if instead of having the patient add that they have visual impairment after the yes, another.
I just want you to keep the choices for high risk, low risk, but when we develop the app, we will remove them. It's just for this demo so that we can get the answer. And then the next question will show up according to our answer here. It's just for the display purposes.
Okay. So is everything clear to now?
Yes.
So
I have a question.
Yes.
Can we add more conditions to get, let's say, the answer high risk? So let's say the patient is more than 65 years and they do have history of falls, but no comorbidities. So can we also add this as a condition to get high risk as an answer?
But then this is a very simplified flowchart that I made. So if a patient that's less than 65 and they don't have history of falls and no comorbidities, they're at low risk for falls, right?
I'm sorry, can you say that again?
Yes, so if a patient is less than 65 and they don't have a history of falls and they don't have a history of comorbidities, they should be at low risk for future falls. But when the opposite, then they should have a high risk of falls.
Okay.
But do you mean that maybe instead of yes or no to the comorbidities, you mean that, for example, they have hypertension, diabetes, or is that what you mean?
I just meant that if it's like a different combination, so not everyone who like tries on to answer these questions will have the combination of more than 65. Yes, maybe it's gonna be more than 65, and then yes, and then no.
Oh, so I mean if
So,
it's he is more
can we
than
add more
65
conditions
with
to get
a
that risk?
no.
Yes, I think, right? We can add more answers for different combination. It's just something that you need to add it as she did previously.
Okay.
So we'll just change the visibility according to what we're following.
Okay. Thank you.
So now for the sheet 1, we don't want it to be sheet 1. So we want to be labeled as assessment, fall assessment, for example. So I just clicked on the sheet itself here, and now I'm going to change the name. So now it is fall assessment. If you guys can see it. Now we want to add educational part for the app. So I'm going to go to my Excel sheet, and I'm going to make a new sheet. I can call it education. So I'm going to go here, rename it to education. And my first cell, I can say also education. And then I can search for example, the risk of falls, the prevention, and the after fall. So after fall, what should the person do after they fall? So for this Excel sheet, we always need a title for each cell. So for me, I always like to add information 1, for example, and then information 2. And you can add as much as you need for each cell. So I'm just going to add, for example, 6 informations. Okay, so information 5 and information 6. So I found some information on the risk of falls. I'll just be copying it from my document to the Excel sheet. So let's check it. Okay, so here are my risks. So I'll just take it as it is. It says many things can cause falls. Your eyesight, your hearing reflexes might not be as sharp, and as you were young, certain conditions such as diabetes, hypertension, thyroid, nerve, feet, and vessels. So I copy it. These are my risks. I don't take the title. I can add a title later on. And then I go to the cell which is in front of my risk, which is the title. So now I'm going to come here and I'm going to add my information, which is this. Okay, I'm going to readjust it so it looks good in Excel sheet file. So now I'll go to my app. I just added one information. I added a new sheet. I added information, and I added information for risk falls under information 1 in my sheet 3, which is education. So I'll go to my app and I'm going to go to data to resync the information that I just added to ensure that it's there. And it's already, before I even sync it, so it's already added. Sometimes it does it for you, but it's good to resync it every time you add something, so it is easier for you. So now I can see it that my risk and the information is added, but I need to go to my app and I need to add it. So right now I don't have the navigation for education. There's no tab for education here. I need to add it. So I will go to my navigation. I'll click my plus sign, And yes, my screen from data, and it is my education sheet. And I will click it, and it has been added right here. Now it gives me the education. It tried to add it for me, but I'm going to remove what added. Okay, and I want it to be added as a form of either list, or it could be grid, or it could be a card, or a checklist maybe. It can be a calendar, but there's different views. It can be for different choices for different situations that you guys might need. So today I'm going to choose it as a list. So I have my list, which is risk, prevention, and afterfall. So once I choose my risk, which is where I want my information to be added, and it already added for me the information. So it says my information, which is the many things, and many things can cause falls, certain conditions such as diabetes, hypertension, thyroid, and blood vessels. Okay, so this is where it is. Now, we just added the first part for the risk. How about adding for the other parts, which is the prevention? We have to go to our Excel sheet. Okay, but before that, we need our information. So we'll come back to our information, and now the how to prevent the falls. So I'm going to just copy it. Okay, copy. Now I want to add it here. So can someone help me add it to the sheet over here in front of prevention? Where am I going to add it?
Information too?
Yes, I want to add the information for prevention here. So am I going to add information too in front of risk, or information two in front of prevention, or would it be information 3?
Information 2 in front of prevention.
But now that's added. Okay, let's say paste it here. Okay, and now I'm just going to readjust it for us. Doesn't change anything in the app. Okay, so now let's add it in the app. I'm going to go to the app. I'm going to go to data. I'm going to resync it. Okay, now I can see that it's added. I'll go to my layout, and now I can see that it's been added to prevention. Okay, but let me check if it overlapped with my risk. So I go to my risk, and there's no overlap. You can see it. Yes, so there's no overlap, and I can see it here. My prevention is added. But when I add it like this, it doesn't appear like risk, right? It appears very congested, since it's like from the start, I can just see everything in front of the list, rather than when I open it and then I see the information. So we don't want it like this, because the patient or the user, sorry, hold on. Yes, sorry. So we don't want it like this, right? We want it to be more presentable and more easier to be read, instead of appearing like this. So we'll go to the Excel sheet, and instead of adding it under information 2 in front of prevention, we're going to cut it from here, leave a space, and add it in front of information 3. Okay, so every time we add something, if it's the first information, it's under information 1, and then we're going to go into information 2, go down, which is the second one that we want to add right now, and then leave a space, and under information 3 would be the new information that we want to add. So now let's go to the app. We're going to go to data, and we're going to resync it. Okay, now we check the layout. Yes, now we can see that the prevention, I don't see all the information from the beginning, but when I click on it, I see the information. Okay.
May I ask something?
Yes, yes. Go ahead.
What happens if we wrote may you press on the full app Google Doc, the spreadsheet? Can
Excel sheet, yes.
Yes. What happens if we made the risk prevention after all as different columns, not on the same column? We will get the same result.
If we add the what do you mean? You mean that I add the information all under the?
I mean, if you wrote education and then in different columns you wrote risk prevention and after all, and information will be on the same column in different rows.
You mean
Do you
the
understand?
information as the rows and the education and risk as
Yes.
the columns?
Yes, we will get the same result or it will be different. I mean, is it a must that we write it in this arrangement so that we can get the result on the app?
I never tried. This is the only way that I tried, but I'm not sure if Dr. Nader has tried it.
Yeah, let's do it. Just go to column B1 and also education itself. You can go back. Just copy paste risk and put it in B1, B2.
Okay.
And then prevention in C2. And then after all, D2, D1.
Yeah, just say finish one. Okay. So
and
let's
then you can move D2 to D3 to D2. Actually, this will go to prevention, right? Go to C. C2.
Yeah, C. Yes.
And then C.
Yes, I'll go back to the app and try to sync it. Sync. Okay, so now let's check. Okay. So it comes back as the information 1, information 2, information 3.
So you can decide what to do. So if you click on the collection on the left side, on the component, under component.
Yes.
Click on it. If you click on it, on the right side, all the way, there is item data, down, down, down. Here you can decide what item, what you want to display, only the first. So title, and then you can remove that, go to the second, and you can, prevention, go to prevention. One below.
Here.
And then let it custom, leave it custom, and leave it blank. So this will not show. And then the image as so.
Yes.
So it will show only the headings, if you will. So column A has the heading information 1, 2, 3. When you can click on information 1, for instance, here.
Here.
Yeah, click on it. It will display the data, whatever data you want. It will be the component on the left side.
So it always adds the headings on the rows. It always adds the headings on the, not on the columns.
Yeah.
Okay.
So there are different ways of displaying the data. So you can play around how you display it to the user. So whatever way you want, you can do it, and it's preference. So for you, it might be different than mine, and someone else might put it differently. So the idea is what kind of education information you want to display, and you put them in the spreadsheet as Mafaz did, and then you can come and then adjust it on the user page or the display page layout So you can play around and see what exactly you want the user to click on and then display what. So all this can be changed according to what you think fit.
Yeah. Yes. Okay, thank you.
Okay. I'm going to go back to the Excel sheet and I'll change it back to the way that it was. So I'm going to take back the risk and put it under education, take back the prevention and the after all mass and put it here. And add information 1 and 3. And this is the information for prevention. I'll be added under the information 3. Okay. And now let's resync it in the app and see how it is. So resync. Okay. Okay, so now we need to remove one of them. One is the one we last added, and the other one is the one that we just worked on, which is we have the risk or the titles on the rows and the columns has the information. So now we open the risk and it has the risk information. And when we open our prevention, it has our prevention information. So now we want to add our after all mass or the after effect or how the person that falls, how should they act. I have the information here. I'm going to scroll down and find. Okay, so what to do if you fall? We'll just copy this. Okay, so can someone tell me where will I add how the person should act after a fall?
Under information 4?
No, so right now we filled information 3. So
yes.
If we add it under information 4, the information will overlap with information 3, which is the prevention information. So we just need to.
Yes, Dr. Mafaz.
Yes, we just need to go to information 5. So just leave one space between each information.
So they don't overlap with each other.
Yes.
Yeah, okay.
Now for the after fall, I just added into information 5. Hold on. I need to double click activate the cell and then paste into one cell. Then I will just readjust. So sometimes, what if we have more than one information for the same title? So risk has more than one information or two sentences. So when that happens, that means that I need to add the second information, which is under the risk. I need to add it in the information 2, but then I will have to readjust the other information so it doesn't overlap. So for example, if I was to add I want to add the risk of the after fall information instead of having it as, for example, instead of the risk, prevention, and after fall, I will just add the prevention and risk. So there's no after fall. So that makes the prevention having 2 sentences, right? So I will remove the after fall. It's not added to the list anymore, but I will take the information for the after fall and add it right next to the prevention information. So it will be under information 4. So now when I go back to the app, I have to resync. So now my after fall is gone. and the information for after fall is added to prevention. So my prevention is here, and it's right here, my information. So this is my fields. These are my information. Is this clear?
Yes, Dr.
Yes. So what if you don't want to add you don't want to be left with only two choices or two lists? You can do the same. Just go to the Excel sheet, add your after fall. Add your after fall, take your information, and then you add it to the space which is in front of the title, but one space after the first information. So it's now here. And go back, resync it. And then that's it. What if you want to add a link, for example, to reference what you used the information from? So you go to content, you go to links, search for link. And this is your link, but we didn't add it to the Excel sheet. So I need to add my link, right? So I'll go to my Excel sheet. I will add link 1, for example. Okay, and then I'll go to my references, and I have my link here. So now I can copy it and add my link to link 1. Okay, now I'll go here, sync it first. Then when I go back to my layout, yes, when I go back to my layout, which is the risk, and now I can search for link. And it takes me back to link 1. And I can change the icon for it. Yes, and this is my, hold on, let me remove this. Yes, so I go to my title, and my information is in link 1. So now I see my link. It can be in row, it can be in compact style. I can change my icon for it, but now I can't. But you should be able to change the icon. And this is how we add the, yes, there it is. I can, for example, change it to this to make it for an icon for my link. And this is how I add the link. There's other ways to provide your information or make it visible to people. For example, I can make a new sheet, or yes, I have a new sheet here. Instead of it being as lists, I have my sheet 4. So I'll go here, I will add a new navigation, which is sheet 4. Hold on. Yes, sheet 4. Okay, let's name it then. Two. Okay, let's sync. Okay, we can just form a table manually. So, okay, once we go out to the layout, we can add our new screen. And this is it here. Now I want it in a form of, for example, a list, but then I can remove this. And there is sometimes where, if you remember, in certain apps where they have a place for frequent questions asked. So we can do the same thing, which is similar, but we will need a action text. Okay, so we go to action text, and for this one, it's a bit complex because it needs a code. So this one, we will take our code, which is for the drop down list. We take it as it is, the title to the details to the end. Okay, I'll just copy it as it is in the over here. Go to custom, so I can add it. I'll just paste it. Okay, so once I paste it, I want my question, for example, is what are the risks, right? What are the risks? Then I take my risks. Sorry. Okay, good. We'll take the code.
Mafaz, I think you selected the. Is this what you want?
No, I want it to be a drop list rather than.
I think you selected title. I think you need to go to component, delete this, and I think it's one of the text type text. It's rich text. Yes.
Yes. Yes, thank you. Turn out it's rich text.
You're welcome. And delete this and can paste the.
Now my question is, what are the risks of fall? And then I'll go and take my answers with the risk. And this is the one for the drop-down list. Is this one clear? So I was just a bit confused about this one.
Yes, it's clear. So
Is it
Dr.
clear?
Mafaz, I have a question, like why at the end for searching what are the risk of fall, we choose the rich text? What's like reason behind this?
For the rich text?
Yes.
So the rich text, it's allowed us to make a drop list for our answers. So instead of having it as a list over here, where I click it and then all the information is available, with the rich text, it's actually just a drop down. So it looks very good for the users. So they can just choose what they want to read and open it and read it and close it and then open something else to read about it.
Okay. Thank you.
Okay. Then the last thing is the layout. So we go to settings and we change the appearance. We wanted, for example, maybe blue. So everything is here blue. We changed it. We wanted dark style or light or accented. You can change the width, maybe smaller width or large. So this is probably everything. Does anyone have a question? Okay, I think that's it for today. This is what I had to share about. Yes.
I have one question. How to add the participants who participate in this app?
They're users. Yes, thank you.
Yeah.
So this one, with Glide app, they already give us a part or a sheet for the data collection for the users. So I go to data, I go to users, and then they already gave me an example. So I can collect the name, I can collect the email, I can collect the photo of the person and the role. So who are they? So with the form, this might be enough for the name, the email. For example, if I want to add something else, I just go to here, click the plus button. And for example, I want to add the, for example, date of birth. And then they can either type it, or it could be a number or a date and time. So for example, I don't want it to be texted, but I want to be number. So they have to add it. So it will be there. Wait, I didn't add it, sorry. Date of birth. Yes, and okay, I'll make it a number and I'll say done. So now it's added. So this means that when I go to layout and over here I click it's the users. So here the users, this will be the information. But for example, what if I want my users to be available under the settings, right? That's where it usually is. So I can drag the users from the navigation and drop to the menu. So this part, the bottom part, is our navigation, but the part for the settings is our menu. So now my menu has the users in it. And I can change the style of the user. So for example, I don't want it as a card, sorry. I want it as a grid, I want it as a list, I want it as a checklist, which doesn't make sense as a checklist, but for example, a grid or a list or a card. So that's, and then there's the user profile. This is how it will be seen. This is where you can add the role. Yes, this is from the user's information.
Thank you.
Thank you. Does anyone have another question? Okay, thank you guys for listening to me, and sorry if it was very lengthy, but I hope it was very helpful. And this idea for the fall assessment is very good, and I think if anyone is interested in it, to go ahead, and I'll be more than happy to, I'll be very happy to help you, and good luck to everyone. Thank you so much for listening to me today.
Thank you so much, Dr. Mafaz. It's an excellent interactive session, and I'm sure everybody got it. For anybody need more information about it, this session is recorded, so you can all the time go back and just listen back to that video. So we conclude our session for today. Thank you for all the presenters. Thank you for you guys for being patient with us and listening to us. Dr. Nader, if you have any addition, we have, I think, I don't know if you want to proceed with the other topic in our agenda today.
Thank you so much. Thank you, Israa, for I think topics and this.
Dr. Nader, you're breaking.
Thank you for attending.
We cannot hear you well.
Thank you, everyone. Just want to say thank you to Mafaz for the tutorial. and we'll see you next week. Send me an email.
Hello,
See you
Dr.
next.
Nader.
Yes.
Yeah, sorry, Dr. Nader. Sorry to interrupt you. Dr.
Sure,
Nader,
sure.
like
Yeah.
Dr. Ala responded first for the leadership. So it's okay, she can be a leader and I can be a team member. That's okay. But like thing is that we have lots of members. Everybody want to join, like, you know, for the making this vaccination app. So how we like, you know, decide? I think everybody wants to join. It's
That's
a very
fine.
good
That's
thing,
fine.
but yes,
Yeah,
yes.
it's a good thing. So for the app itself, there is no limitation. We just wanted to make the numbers small so that everyone can contribute. For the poster, we have limitation because when we submit it, they have a certain number of authors. We don't want to send like 15 or 20 in one poster. But for the app, I think there is no limitation for one app if all of them are interested in the same topic or same. But I want everyone who is interested to participate, to learn how to do it, to work with you guys. And if there is certain task, I want the task to be divided into the whole team. It's not supposed to be done by one person or two persons, and then the others will get the credit for basically doing nothing. So I want everyone who is interested to learn the process, to participate, and to take some task and to handle it and see how it works and develop it. It's just a matter of try, error. You cannot do it, ask, you will find the answer, try it again, you will find it interesting that you solved it. You try to display it, ask your family members, your friends to look at it. Start with a very small demo, similar to what Mafaz was doing. So if I have 10 questions, I will start with 2 questions, develop the app, and see how it looks, how it works, how it like the function, and test it, ask someone to test it for you. And if everything goes well, then you want to build more questions, like the list of 10 questions. If you did the whole 10 questions, the next step, you want to do the education part. So divide that into next step. So if you do it step by step, I think you will learn a lot. You can do as many apps. And the beauty about it is if you all focus on only one, when you work on it, then you will have ideas about, hey, I may use the same concept for a different thing. I want to do education about, today we talked about falls. Maybe I want to do education about heart attack or a stroke or something else. So this is a new idea. So you will just try to build that app for the topic that you choose. And it's going to be the same concept, same steps. You want to build it piece by piece. You start small, and then educational part, you want to add videos, you want to, it's just fun. If you want to do it all together, you can work in teams to start with. I have no objection of getting you all in one team. But in the past, I think people are busy and they did not participate when they showed interest. But now, I think if you are interested, the team leader can assign tasks for you, or you can take the step by yourself. You want to learn how to build the sheet the same way Mafaz did, and then try it out with baby steps on the app, see if it's working. If it's not, what's going wrong, ask, and then you will get the answers, try it again, and so forth. So to answer your question, Maya, everyone is welcome to join your team. There is no limitation, but I want you to know, and the other team members or leaders, that I want everyone to be participating so that they can learn. And when they talk about it, let's say in an interview in the future, they know exactly how to answer the question. They will ask you, so tell me about this app. What did you do? I don't want you to be, I want you to answer, we did this, I did this, my part was this, I did this task, and the other team member built the other component, this. So you will have a better understanding of how we develop the app, the result, the end product, if that makes sense.
Yeah, sounds good, Dr. Nader. We'll coordinate. All fellows, yes, we'll coordinate, and we'll definitely get the help from Dr. Mafaz and Dr. Amal, because they already created an app, so they have good idea about it. Thank you so much. Thank you.
You're welcome. And by the way, there are a lot of how to do videos. The website itself, Glide app, they have, because they have templates that you can just copy and modify, or they have videos of how to, let's say you want to add users, the last part of the demo. You want the app to have different users so that they can log in, they put their information. They have some way of doing that. So you will look at the videos for that and follow the steps one by step, one step at a time, and you can create whatever you want according to the videos. If you're stuck, there are a community there. You just send your question. I'm doing this and I want to reach this. How can I do that? There are very good people there who will just take you one step at a time. They can help you achieve the goal. Let's say I want to display this in certain ways, but I don't know how. You add that to the question in the community. Someone of the community will get back to you. You can do it this way or that way. I learned it this way. I had no idea about the program when I logged in initially. It was just learning from each other. So I learned some tricks, and I have difficulty in doing certain tasks. So I asked, and then someone helped me. So now I become an expert in doing some of the spreadsheet, for example. Another member asked a question, then I will be answering them, hey, you can do it this way. So there are a lot of resources for you guys. As you said, Mafaz and Ahmed, they did it before you, so they can help you. I'll be available to help as well, but there are a lot of videos there of how to do it. Thank you.
Thank you so much. Thank you.
You're welcome. Any other questions? Yeah.
Hi, I'm new, I might be new here, but I have a few questions. I'm added to the, it might not be related to this one, but I'm added to the WhatsApp group, but I don't see anything in the WhatsApp. I could not see. Maybe there's other groups or anything, but I cannot retrieve or learn anything. It's just empty. That's what I wanted to ask.
Perhaps Mafaz, can you add her to the large group, and then maybe she can join the white team?
The white team? The whole
just refer her to the just the WhatsApp.
Yes,
WhatsApp
I'll
group.
search for your name and I'll add it to the group as well.
Yes, me too, Dr. Nader. Hello, everyone. My name is Ala. Yeah, I'm new.
So if you can do this.
And I don't know which group I'm in it. I don't, they don't add me even in the WhatsApp.
So if you first can add both of them, and both of you, you will be joining the white team.
All right.
Yes, me too, Dr. Nader. I wasn't also added.
Ladin and Mega as well.
It's Ladin, yes. Thank you.
Ladin and Mega as well.
Thank you so much, Dr. Nader.
Hello, Dr. Nader. Me too. I didn't. My name is Ala Osama. I didn't join to any subgroups until now.
So perhaps Ala, Omar, and Osama, and Almaz Osman as well.
Yeah, thank you.
No problem. Thank you.
السلام عليكم.
عليكم السلام ورحمة الله.
أنا شهد الأزرق. أنا برضو I'm not in any subgroup, please. If you can add me.
If we can add Shahd as well.
Thank you. Thank you so much.
So, Dr. Nader,
Yes.
I would like to see if we can create a group for leaders, and we add you in that group, so we can be easy communicate between leaders together and communicate with you directly. For any other question,
I appreciate that. I appreciate that. That would be great if you can add me to the leadership group.
Okay.
In WhatsApp. That would be great, and then we can discuss.
Okay. And also, I want to add one thing that I don't know if Dr. Amal, she's still here, related to our INR app. Our last communication with you that you were supposed to do the presentation. You were supposed to do the presentation, or I mean the videos. So we had some difficulties regarding like the copyrights for how to translate the videos from Google, from YouTube to Arabic. So we took a different route that we currently we create new videos and we translate them. And now we're in a process that we communicate with some video creators, so we can do like animated video. So that's why we are kind of late to finish with it. Yeah, but everything is completely done. It's just we're waiting for them to create the animated video, and even the transcript is already ready and sent to them.
Excellent. That would be great.
All right. Thank you.
Thank you for the update.
You're welcome.
Any updates? Otherwise, any other comments or any other news questions?
Hi, Dr. Nader, can you hear me?
Yes, go ahead.
Sorry, the background noise. Regarding the app, instead of 50 or 60 people focusing on one app, I have sent you an email to kind of partition the people so that 8 people will participate with the same project design of dividing an app, developing an app, but focusing on a different topic. So it would be nice, just check the email. There are 7 or 8 topics that I have come up with. So it would be like involving 8 to 10 people per topic. Those people who want to do gynae, pediatrics, or emergency medicine, they can pick the topic, but of course they will use the same principle of developing the app, so that instead of maybe 40 or 30 people focusing on one group, we can divide ourselves in that way.
I think it's a good idea. So if you can reach out to Maya, Mafaz, Ahmed, Nafisa, and see, I think it's a good idea to divide into, as you mentioned, people have different interests. So if we put like options for them, this is option for pediatric, the vaccine, or geriatric, we can also build a vaccine for geriatric. Falls is one, family medicine, maybe we can do something, or emergency medicine, neurology, whatever component in your suggestion, just put it so that I think there is a list of interested fellows who contacted the group. I think Maya, one of them, to build apps. So if, let's say, we have the 50, we give them these options, and then they can select which one they want to join. So it's gonna be subdivision or subgroups. Each can be 8, 10 in one app development, and then each can select one leader for that project, for that app development, and then the leader will divide the task. So each one will learn how to develop it, but to change things around, or to test it, or to get the basics information. All these are different tasks, so maybe will be assigned to different fellows. I know some might be in Sudan, for example, who are interested, but with the situation now in Sudan, they may not be able to participate at this time. So maybe in the future, we can give them a chance to come across or join the teams later on, if they are interested in building some apps as well. So as I mentioned, there is no problem with number, but if you have, as you mentioned, small group, you can divide the task between them, and everyone can build some part. It's like building a car. Each group can work on one part of the car, and then it's like assembly line. You will have the end results as a whole.
The reason I said so, sorry, the reason I said so also is just, for example, if someone have a plan of joining family medicine, and if you end up developing an app for pediatrics, it will be good, but whatever you do, it will be good in line with what kind of program that you want to join, one. And secondly, even though the number may not be a problem, I think the project will look credible if maybe 7 or 8 people prepare an app rather than 15 or 20. So that's why, like, for example, if you have a plan of joining emergency medicine, you can have an app for emergency medical conditions, stroke or diabetes or hypertension or high blood pressure. And if anyone from the group have a plan of joining gynae, for example, trimester bleeding or screening technique for pregnancy, so that whatever kind of residency you are going to apply, you will have an app which is in line with your intention of a residency program you want to join, one. And secondly, it will be also lesser of a headache instead of contacting one team leader like 50 or 40 people of us. And also it is helpful because if you divide the task into subgroup, everyone at the end of the day will master developing the real app. So that's why. So I will forward you the email again, and maybe you can send it to the group. People can pick up what kind of topic they want to join and what kind of program they want to lead. Then it will be a good idea. And that from this project, we have developed 10 or 15 apps distributed again among, 7 subspecialties or 6 subspecialties.
Okay, sounds good. Thank you so much. Anyone else?
Yeah, Dr. Nadia, I have a question.
Yes,
first of all, thank you for all these things and for the opportunity. My question is that I think me and many people here also very excited to do, to improve ourselves and to have this experience, but I feel like a little bit confused where to start. So if you have some advices or I don't know where to start, especially that I want to apply for the next match, when the submission will be in the middle of September. So if there's something that we can start now until, for about 5 months that can be not necessarily completed, but at least something that we can proceed.
So thanks for the question. So one thing you can do, you can use the app that we are using, Research Fellowship. It has some components. So I want you to see what areas you want to improve on and focus on, and you can find some answers from previous fellows or some videos on some, let's say you want to focus on preparing for the interviews. So there are some sections there about the interviews. So most of them like 10-15 minutes. So if you want to watch every day one of these videos, you will improve your skills as far as interview process. But I want you to think about the programs that you are applying to during this period. I want you to obtain more information about the program and try to build some connections. I want you to know the residents there, the staff of the attendings, see their interest and try to match their interest if there is any. Number 2, your CV, and we want you to improve on that. So if you have clinical experience overseas, we need to have some experience clinical here in the US. So you want to participate with some clinics or some way of extension or any type of clinical hands-on here in the US. This is very important. Then we will look at the research part. So if you have an idea about building a project, let's say you want to do a research in certain topics, we can help you identify a question and then build on that. Either you want to do, let's say, a systematic review, we can do the steps, you can build a team, you can work with others. It's very difficult, or maybe it's time consuming, or maybe it will need a lot of resources to do things alone. This is why we divide you into teams. If you have an idea, you can share this idea with some of the team leaders so that similar to the app development, let's say you want a research idea about stroke in whatever, prevention of stroke in children, let's say. You discuss this and then you will ask if anyone interested in this idea. So you will have some, let's say 5 or 10 fellows will share the same interest. So you develop the team for that idea. We call it the project, research project. You will be the leader for that, for example, and divide the tasks. So someone will go do the literature review, someone will collect the data, someone will try to write the abstract, someone will find which conferences we want to submit this title to. So we'll have all people in the team working, and by, let's say, 1 month, 2 months, you will have some product going on. You can send it to me or we can review it and see if it needs some improvement. When we have the product complete and ready, we can submit it before the deadline to the conference. This is what we did in the past with fellows in the past. So you will do that as publication, for example, either abstract or maybe paper. There are other stuff. So let's say you want to work on your personal skills, confidence. I want you to participate with presentation here, ask questions. Maybe you can talk about other skills during our meetings here. Then we have one fellow who teaches Spanish language. So she teaches just medical Spanish. Maybe you can join that group and learn some Spanish. So you will add that to your resume. We have some examples of IRAS application or personal statements from previous fellows who matched to programs. So you can look at this and start working on your personal statement, finish that early enough so that people can look at it and give you feedback. Or you can work on improving your IRAS application. Some of you might have, let's say, last year they applied, but they didn't have luck or a lot of interviews, so they want to try again. So for these people, it's better to add more things into your CV or your IRAS application. Actually, I was asking Akila, she was just in the meeting, but she left. I want her to show you or share with you her experience. So she applied last year, didn't get a lot of interviews, worked on her CV the same way I just explained, improved her CV, and then applied again, and now she has been accepted. And some of the other fellows did the same way in this previous batch and the fellows before that. So there is always room for you to improve. And if you are planning to apply to the same program, they may interview you again, and they will ask you, what did you do during this year since last interview when we had you? What did you do? So if you say, I did this as far as clinical skills, I worked with this, I learned more about EMR, I learned, let's say, clinical Spanish or medical Spanish, I improved my research experience, I joined this fellowship, I worked on 2 projects, I presented 3 topics. So you will have some way of showing them that you are doing your best to improve your application or your status or your qualities, your skills. Sometimes you may just learn some or join some online courses. I advise you to register, for example, to Harvard online classes or courses or other elite institutions. You can join the weekly grand rounds. For example, remotely here, we have it at Sparrow Hospital between Sparrow and Michigan State, or in other institutions if they offer that online. You can attend remotely and you can add that. So it's going to be like you will be updated as far as clinical knowledge. So there are multiple areas that you can do to improve your CV or your application or candidacy. The only thing we want you to do is you work hard to shine and be unique. So when you apply to these programs, one part will be how are you different from other applicants. They will interview 10, 20 during that day. How can you be the one who they remember so that when they put their ranking list, they will remember you, hey, this is the guy or this is a girl or this is the one who did this. So if you can think about things that you can do in this coming months that you can improve on and be unique, I think you will have a good chance. Every one of you is good as far as you graduate from medical school, you have some experience, you are a good candidate. The question is how good you are compared to other applicants. Remember, it's very competitive. So this is how I think you should plan ahead. If I answer your question right.
Yeah, so much. Thank you so much. It's really informative. Thank you, Dr. Nader.
You're welcome and good luck. Any other questions? If no, then yes, go ahead. Hi.
Hello, can you hear me?
Yes, go ahead.
First, I would like to thank you for the last year at least. You showed us compassion and you helped us in different ways so that we will learn about the research, how to connect with people, how to be professional. And I would also like to thank the fact we went 1 hour and a half beyond our scope today in the meeting. I don't know if our team leader, Dr. Akil, have updated you. I think the varicella zoster and myocarditis paper have been published. I don't know if she have updated you on the progress of the paper. And I'd just like to share with the group that one of the papers that have worked under the guidance of Dr. Akil have been published recently. And we will share it with the group so that they will read it and read the paper also.
Excellent. Yeah. So this is a work of some of the groups, and thanks. It's been published, so it's a paper. So again, it's a team approach. So one fellow came with the idea, the question, and then divided between the other fellows who are interested in the same project. So she or one of the fellows led that project team. So divided the idea into writing a manuscript. So they wrote an introduction, the methods, whatever, and they did it and divided, and then they completed it. So we worked on improving it and submitting it to the journal, and they accepted it. So this can be done as well. Sometimes it may take longer, the review process, but sometimes it's faster. If you divide it between you guys, as I said, there are a lot of tools. And when we divide the task into small tasks and divide it between the fellows, things can be done faster, especially if you think about time zones. So if in the East, work with someone, let's say Salma Ali in California, I can work in the morning, she's still asleep. I finished my part. By the time she is awake, I already submit her the section that I wrote. She can review mine, or she can build on that finished her part. When she sent it to someone in Sudan or Saudi Arabia, at that time they are finishing their job. They are free from 5 to 10, for example, so they can review whatever she wrote, and then they can edit, improve on that, and send it to me. So next day I woke up, I have all the things in place, so I can give it a last look, and we can submit it faster instead of doing the whole work in one place with my friend here in Lansing. So we will be sleeping at the same time, working at the same time, going to the work at the same time. So there is no chance for me to, unless we work like in Zoom meeting, like together one-on-one. Otherwise, the team approach using the time zone difference to take that into advantage, I think might work for some people. So I think it worked very good for the fellows, and congratulations to those who participate in that project, and good luck for all other fellows to work on their own projects as well. Excellent. So I know there are other people who are presenting. I think Ryan is presenting or already presented last few days in Boston in person in the American Association of Neurology. It's a big conference. And then I think also there is another fellow is going to present in May in psychiatry conference. And then in June, July, there is another group. They will present at Alzheimer Association conference that will be remote, but the conference will be in the Netherlands, in Holland. So we participating in different conferences here in the US and abroad. But the good news is the teams are working together to prepare and submit this project, and they get accepted, and it's good for the teams. Everyone in that team will be proud, and they can talk about it. They can put it in their resume that they achieved a goal. Thanks. Sorry, I talk too much, so I'll give you forever if you leave me. But any other questions before I'll leave you? If not, then thank you so much, everyone. And thank you for joining the fellowship and joining this Zoom meeting. We wish you all the best, and our prayers go to all these fellows in Sudan. Hopefully they are safe, and their families, friends, and all of you who have any family members, extended family members as well. Hopefully they are safe there. We'll see you next week. Thank you. Assalamu alaikum.
Thank you so much, Dr. Nadir. Assalamu alaikum.
Assalamu alaikum.
Thank you, Dr. Nadir.
Thank you, Dr.
Yeah, assalamu alaikum.